Welcome to the October 8th, 2025 regular meeting of the Washington Township Healthcare District Board of Directors. Public notice of this meeting has been posted appropriately on our website. Tonight's meeting is in person and also accessible by Zoom. I ask that you please mute your system until such time as you need to speak. We are recording tonight's regular session of the board meeting. It will be posted on our website for future viewing. Cheryl, please take the roll.
Director Wallace.
Here.
Director Nicholson.
Present.
Director Yee.
Present.
Director Stewart.
Present.
Director Eapen.
Thank you. Members of the public are invited to speak during oral communications from Township. Please state your name for the records and proceed with a statement not to exceed 3 minutes on issues or concerns not on the agenda and within the subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Not sure. Are there any written communications?
There's no written communication.
Thank you. We will now move to the consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed item and later in the evening under the action item heading of this agenda. Anyone on the board want to remove an agenda item from the consent? Does any member of the public want to remove an agenda item from the calendar? May I have a motion to approve the consent calendar item A?
Consideration of the minutes of the regular meeting of the district board on September 10, 15, 22nd, and 24th, 2025.
Okay. Thank you. Cheryl?
Director Wallace.
Aye.
Director Nicholson.
Aye.
Director Yee.
Aye.
Director Stewart.
Aye.
Director Eapen.
Aye.
Thank you. We're now going to move on into the reports. Dr. Berry, hello, Dr.
Hi.
Berry.
Good evening. How are you all doing?
Good evening. Good evening. Well, I think we're okay. We can't see you, but we can hear you.
Well, let me pull up my notes here. So I will report that the Washington Health medical staff has a grand total of 668 members. 374 of those are active physicians. 39 of those are advanced practitioners, and 102 of those are people with ambulatory status. We have also welcomed a few new members to the medical staff. Dr. Alvarez is a nephrologist. Dr. Jong is an emergency medicine physician. Dr. Paul is an orthopedic trauma surgeon. Dr. Rizos is an orthopedic trauma surgeon. Dr. Sadiq is an internist. And Dr. Saluja is an anesthesiologist. We also are welcoming 2 new teleradiologists as part of StatRad, named Dr. Cole and Dr. Campbell. Aside from that report, I do just want to highlight the continued growth of robotic surgery programs at Washington Health. Last month, we did our first Mako robotic shoulder replacement and also started using the Mako robot for knee and hip replacements. Several of our surgeons are gaining proficiency with those robots. Dr. Saw has been using the Think surgical robot for quite some time now and has recently surpassed 500 knee replacements using the Think robot. So we're excited about the growth of the robotic surgery programs, and I do want to highlight that some of those robot equipment will be at the Top Hat event this weekend on display, and I believe there will be some demos being provided for anyone who's interested in seeing them in action. But that is everything from my report.
Well, not the kind of action where they're actually going to do it.
Just demos.
Okay, do you have any questions?
No.
All right. Thank you, Dr. Barrett.
You're very welcome.
Yes, we have our service league president, Sheila Vijay.
Good evening, everyone. Members of the district board, again, warm greetings on behalf of all our volunteers. In September, 282 Service League volunteers contributed 2,519 hours of service across various hospital departments. On September 15 and 16, Evangeline Imana Iamura, Director of Volunteer Services, and I attended the California Association of Hospitals and Health Systems Volunteer Leadership Conference in San Diego. The conference provided an opportunity to explore new ways to engage volunteers, build strong teams, and enhance patient experience. Sessions focused on topics such as compassionate listening in patient follow-up, humanizing hospitalization, and developing creative volunteer roles. The networking and roundtable discussions shared practical examples of how other hospitals support and recognize their volunteers, ideas we can apply at Washington Health. Insights from the conference reinforce the importance of ensuring that every volunteer has a meaningful role, which brings me to the ongoing Service League programs that exemplify this commitment. Since February 2023, we have partnered with Fremont Adult School to welcome special education students ages 18 through 22, along with their teacher's aide. This partnership allows students to practice following directions, complete structured tasks, and contribute in ways that build confidence and independence. Volunteering also introduces them to a supportive, team-oriented environment, helping them develop skills they can apply beyond the hospital setting. Each week during the school year, 4 to 5 students join us to assemble patient care kits and urine test kits for the emergency department. Over 15 students have participated so far, preparing more than 9,000 urine test kits, averaging 120 each week. They take a break during the summer and school holidays and return each year to continue their volunteer work. We're also proud to highlight the talents of individual students. Ansel Cam, one of the special education students, shares his gift of music on the violin each week in the Washington West lobby, creating a warm, welcoming, and uplifting environment for patients and staff. Krishel Almazam from the School of the Blind played piano in the main hospital lobby from January through May 2025 and will soon be returning to continue her assignment. All these contributions show that the Service League, there is a place for everyone from all walks of life to give back and make a difference. Each volunteer brings their unique skills and interests and positively impact patients, families, and staff. That's the end of my report. Please let me know if you have any questions.
Any questions, anyone? Okay, very good report, Sheila. Thank you very much.
Thank you, Mr. Wallace.
All right, next up, we have the quality report, and this evening we have the dialysis annual update. And we have Dr. Jeannie on in her role as Medical Director of the Acute Dialysis Services. So I'll introduce you, Dr. On. I know many of us know you, and you have been on staff at Washington Hospital since 2001. Dr. On initially came to California for college at the University of California at Berkeley. She returned to Illinois from medical school at the University of Illinois at Chicago before returning to California for her internal medicine residency at Kaiser Oakland. Dr. On completed her nephrology fellowship at UC Davis before joining the staff at Washington Hospital. She has been the medical director of acute dialysis services since 2012, and as we know, is currently the incoming chief of staff elect.
Okay, hello everybody. Good evening. Tonight, I have the pleasure of sharing our dialysis clinical annual report. So our Washington Health Acute Dialysis Unit has gone through several iterations. When I first arrived, it was outsourced to Fresenius, and then internalized, then outsourced to DaVita. And in August of 2018, We internalize the service again. We provide the procedures of hemodialysis, peritoneal dialysis, and plasmapheresis. We're currently located in 3 South Main Hospital, but looking forward to our glamorous new surroundings when the build is made. We are we provide service 7 days a week, 24 hours a day. On Sundays, we provide on-call services as needed. So a little explanation about what we do. What is dialysis? Dialysis is also known as an artificial kidney. Your kidneys remove waste products, toxins, salt, extra water from the body and help maintain normal levels of certain electrolytes such as sodium, potassium, and bicarbonate. So the patients who require dialysis fall into 2 categories. One is are patients with acute kidney failure from overwhelming infection, trauma, or other sudden catastrophic health events. And second, are patients who do not have kidney function due to progressive irreversible loss of function from diabetes, high blood pressure, or other chronic illnesses. So there are 2 flavors of dialysis. There's the hemodialysis and peritoneal dialysis. Hemodialysis is where the blood passes through a filter, and this requires the use of needles or a catheter in order to provide access to your blood. Peritoneal dialysis is when the toxins are removed using a tube that's placed into your abdominal space. Sterile fluid is placed into the abdomen, the toxins filter into the fluid, and then the fluid is drained out of the body, and in that way, your body is cleaned of toxins. So peritoneal dialysis doesn't require any doesn't require any needles or contact with blood. Our hospital also provides plasmapheresis. Plasmapheresis is not dialysis, but commonly uses the same kind of acute catheters we use for dialysis. Plasmapheresis is a process of removing blood plasma from the body by taking the whole blood and spinning it in a centrifuge to separate the cells from the plasma and replacing the cells back to the patient, but not the plasma. So we use plasmapheresis to treat conditions in which a protein in your body, such as an immunoglobulin, is toxic to the body. Many conditions, including neurologic, hematologic, rheumatologic, and kidney diseases, as well as intoxication, can be treated with plasmapheresis. So service utilization for our fiscal year ending June 2025. As you can see, the majority of the treatments at this hospital are hemodialysis treatments. We have some plasmapheresis. Our peritoneal dialysis patients are much fewer and tend to be less frequently hospitalized. Our dialysis volume has increased by 281 treatments in fiscal year 2025 compared to fiscal year 2024, reflecting a rise in patient demand and service utilization. Our patient and safety measures include timeout documentations, hepatitis B surface antigen measurements, hypotensive events, rapid response or code blues during dialysis, and infection control. Infection control includes hand hygiene, water cultures, MRSA monitoring, and central line infections. Hepatitis B, if patients have hepatitis B that is known, the machine must be bleached after use. If the status is unknown, we treat it as if they're positive and we clean the machines, and the machines cannot be put back into use for approximately 2 hours. At this facility, the hepatitis B antigen is it is done in-house that allows us to have a very quick turnaround time. And as you can see, we have an amazing low, hepatitis B status unknown. In June, we had 1%. So our safety record, or this increases our ability to provide quicker services by not holding those machines back. Next slide. Hypotensive events, we exclude ICU and CCU patients. So common reasons why patients cannot reach the or have hypotensive events include if quite often patients are on the volume depleted side, if they don't feel well, they don't eat, if they have cardiac events or infections that causes their blood pressure to be lower than they normally would, then their outpatient orders may not be, may result in them having hypotension and unable to reach the usual ultrafiltration goals. But this is something that we track. Next slide. We also monitor the number of rapid response calls, and we look at this to see why the patients required a rapid response as well. That is to see if they were unstable on the floor and maybe not appropriate for the 3 self-dialysis room to begin with, or if the treatment itself precipitated a need to call rapid response. Next slide. This is an example of our water culture and endotoxin screenings. As you can see, we have 7 hemodialysis machines, and the reverse osmosis machines are also tested monthly. Next slide. Patient education, since the patients are our guests at the dialysis room for commonly 3 to 4 hours, we take this opportunity to share some education while they're there. And we typically run between 90 and 98% for the patients that are able to receive the education. Next slide. Okay, so our performance improvement goal was to look at our rate of needle infiltrations during fistula access. So we implemented the use of ultrasound guided cannulation for those patients that are identified as having a difficult vascular access. Our goal is to reduce infiltration related complications and increase our cannulation success. We track the impact of ultrasound-guided cannulation on the frequency of needle infiltration events. We review those monthly, and in collaboration with the rest of the infection prevention, dialysis technicians, the nursing staff, IB therapy team, and also IT for EMR support. Next slide. This is our continuous quality blueprint for fiscal year 2026. It includes patient education, procedure timeout, compliance with endotoxin testing, compliance with our water testing, our stat treatment completions, hand hygiene. Next slide. Our accomplishments during the year. Our MRSA swab compliance rate has gone up for dialysis patients. We've continued to maintain zero CLABSI rate for dialysis catheters. Our staff also provide input into patient rounding in order to improve overall satisfaction. One of these components is to improve communication with the transport team in order to decrease the delay, so patients are not waiting for a long time to go back to the rooms, and also not waiting a long time to come and get their treatments done. Our hand hygiene compliance has remained one of the best in the hospital at 100%. So for continuous learning, we continue to work with the infection control to increase our MRSA swab compliance. What this is there's a Senate Bill 1058 that was implemented in 2008 that requires acute hospitals to monitor their MRSA on admission and upon discharge in certain patient populations. And in this hospital, the dialysis patient population was selected. So this is why it falls under our CAD or monitoring. So we also want to, oh, can we go back to the other slide? So we're maintaining a zero CLABSI for dialysis catheters, and the staff has completed training in peritoneal dialysis and also plasmapheresis. So all of our staff are able to do perform all of the modalities that are offered. Next slide. So we have a very stable dialysis staff. They like to work here. They especially like our nurse manager, Gina, who works hard to provide our coordination and liaison with the rest of the hospital community. We work to provide the best care to our patients and community with compassion and our dedication to continuous improvement. Next steps. We have we're looking at initiation of the of an ultrasound guided access process improvement project, evaluating health disparities data to determine areas of education and resource opportunities. And I think something that we always work on is improving the care coordination of our special population of dialysis patients. Okay, thank you very much for your attention. Be happy to answer any questions if you have any.
Thank you, Dr. Ahn. Is there any questions?
No.
Thank you for your presentation.
Thank you.
Thank you.
Thank you.
All right, next we have Ajay, who is going to give the finance report for August.
Yes, thank you. If you'll remember recall from the last meeting, the operating indicators it's been for the last 2 months, have sort of similar trend. Our patient days have been lower, but our discharges have been fairly close to budget, resulting in our length of stay actually being lower than what we projected, which is a mixed blessing.
Mm-hmm.
So that means that we have less patients in the hospital, but our discharges are still doing pretty well. Our outpatient observation equivalent days are a little lower, and I think the work that's being that we've talked about earlier, of managing the observations and really looking at them and getting them to the right level of care, that work is still going well. Next slide is related to our case mix index, a little below what we budgeted. Our deliveries have been strong. Surgical cases, 21 off our budget. Cath lab cases, 23 over budget. Outpatient visits were strong, and ED visits were very close to budget. On the surgical cases, which were 21 below, the majority of that was between neurosurgery and orthopedics. Those were both below what we had expected. Cath lab cases, IR was 20 over of the 23 that was over. Next slide is on our productivity indicators. In August, the organization flexed well. We were almost 64 FTEs below our static budget. Although on a FTE per adjusted occupied bed, we were about roughly about 0.07 higher than what we had projected. I'll just make a little bit more of a comment here. You know, looking at if we are 64.3 FTEs below budget, I would roughly expect our salary expense to be about close to $1 million lower than our budget. What we were really was about 111,000 below budget, and there's some factors that were causing that. Some of them were, this was a 3-pay period, so we had, you know, because we have 26-pay period during the year, 2 months get the benefit of 3-pay periods. So that 3rd pay period then added in higher than budgeted education, orientation, and those kinds of things that helped, unfortunately, offset some of those savings. And there was also higher than usual ETO. And some of our contract labor rates that, you know, we have a few more travelers and things coming in and contract labor, those rates were a little higher than budget. So that offset some of those labor savings. Moving on to deductions, as you will see towards the middle of the page, the contractuals were almost like a percentage point better. If you'll recall, last month the payer mix was pretty strong. Our PPO payer mix was pretty good. However, the bad debt provisions were a little higher, about 0.5 point. But overall, our deductions were about 0.5 percentage point better than what we had budgeted. However, the main thing on this page is that gross patient revenue. The top line, we were about $10.3 million below budget on that, you'll recall from our conversation last. On the summary of operations, you will note our net operating revenue was about $1 million lower than budget, and our operating expenses similarly was about $1 million lower than budget. So we became pretty close to budget. We were at 1.3 million versus 1.3 million on the budget versus actual. The net operating margin was negative 2.4 versus negative 2.3. However, our non-operating income was strong in the month. As you will recall, August, the markets did pretty well. And that was at 2.6 million. We budgeted 1.1, so we were about 1.4 million better, resulting in net income being about 1.5 million ahead of budget, because we expected a little bit of a loss, and we actually came in at 2.4% versus a loss of negative 0.3. Similarly, on the year, we are at a net income margin of 1.2% versus a loss of negative 0.2%. On the FASB format, I won't spend a lot of time on this. This just splits out the same data slightly differently. On the last page of the financial report, you will note that the EBITDA remains close to budget. We're at 2.3 million against the budget, or 2.25 million for the month, 52,000, 2.3% better. And for the year, we're at 5.2 million versus 4.4, about 800,000 better than budget. Take any questions about it?
Thank you.
Thank you.
All right, I'll move on to the September operations report. You'll see that we did have higher than budgeted just overall gross revenue. We also you will also see this month in terms of looking at our trauma volume was the highest that we've ever had this month, along with that gross revenue. So you'll start to see that through this. But starting as always with our outpatient observation, days came in at 181, 91 days, or 33.3% favorable to the budget of 200. Then going on to our preliminary total gross revenue, as you can see, we came in at 230.3 million for September. It was favorable to the budget of 216.3 by 14 million, or 6.5%. And I will, go on to show you that it was driven, it was also driven mainly by outpatient that are, we also had higher inpatient gross revenues too. Okay, so our trauma, our emergency room and trauma services were very busy. We had 196 cases for September, which was favorable to the budget of 142 by 54 or 38%. And this is the highest trauma volume that we've seen since we've opened. So we had inpatient trauma cases of 78 for September, which were favorable to the budget of 49 by 29 or 59.2%, and outpatient trauma cases of 118 for September were favorable to the budget of 93 by 25 or 26.9%. So we had both inpatient and outpatient increases. Looking at the activation codes, as you know, it tells you the acuity of the level of trauma that we're seeing. You can see that for September, we had 13 alpha, 42 bravo, and 138 delta cases. And then we also had 3 that came in with no notifications. So that means those patients came into the ED without prior notifications, basically. They walked into the emergency. And that they will later be, of course, in terms of put into the overall numbers. But in terms of 196 trauma cases, we saw 79 falls, 38 more motor vehicle crashes, 13 body injuries, and 9 other, and then also 51 that were no specific chief complaints. So still saw a lot of falls. Looking at our overall trauma gross revenue, came in at $24.6 million for September. Again, this is also the highest gross revenue we've seen since opening in July 1st of 2024. It was favorable to the budget of $17.4 million by $7.2 million or 41.7%. Our inpatient trauma gross revenue of $18.1 million for September was favorable to the budget of $12.5 million by $5.6 million or 45%. And outpatient trauma gross revenue of $6.5 million for September was favorable to the budget of $4.9 million or by $1.6 million or 33.2%. Both of them were above budget. Moving on to our overall inpatient gross revenue, you can see it came in at 139.3, which was favorable to the budget by $5.1 million or 3.8%. In terms of the favorable performance in September was primarily driven by ancillary services, or cath lab and surgical services, and birthing center and emergency. Looking at outpatient gross revenue, that came in at $91 million, which was favorable to the budget by $8.9 million or 10.8%. And again, also favorable to last year, September of 2024, by 1.9%. Again, also mainly driven by ancillary services, surgical services, and emergency room services. Looking at our inpatient average length of stay, came in for the month of September at 4.97. It was favorable to the budget of 5.22 by 5%. I also want to say this length of stay was driven upwards because we had 2 patients that were discharged home that had more than 100 days length of stay. So I think we would have seen even less in terms of our length of stay. But we did have 2 long length of stay patients that were discharged. In terms of our trauma length, average length of stay came in at 4.32. Looking at our discharges, September discharges of 1,076 were favorable to the budget of 1,004 by 7.2%. So again, similar trend that we've seen in the past. Year-to-date discharges were 3,266, which were favorable to the budget by 122 or 3.9%. Also, still in-house in terms of length of stay of patients longer than 30 days. We only have 5 patients, and they range from 31 days to 46. So again, then we're in terms of trying to ensure that patients who are not medically necessary to be in-house be transferred to that next level of care. Looking at our patient days trends, this continues in terms of looking at patient days Of 5,145, they were unfavorable to the budget. Of 5,239 by 1.8%. And again, mainly due to the lower length of stay that we've been seeing. Moving on to our inpatient average daily census, it came in at 171.5, which was unfavorable to the budget of 174.6 by 3.1 or 1.8%. And again, mainly driven due to the lower patient days, but favorable if you look back at September of 2024. That came in about 18.8 equivalent days better. Looking at our surgical trend, we had a busy surgical month. Total surgeries came in at 564, which were favorable to the budget of 499 by 65 or 13%. We had both inpatient surgeries that were favorable to the budget by 13.3%, and outpatient surgeries at 292 were also favorable to the budget by 12.7%. We also did 8 TAVR cases in September. Moving on, you can see the breakdown of our surgical activity. I do want to note a couple of areas. You can see our gastroenterology cases came in at 145, is 28.3% above the budget, and we think that is probably one of the highest volumes that we've seen in terms of GI cases in-house. Also, I know Dr. Berry mentioned this, that as you can see, we had a busy orthopedics month also. And as he mentioned, we launched the Stryker Mako orthopedic robotic platform at the end of August, and we did 7 robotic cases that were performed in September. Dr. Kostouris did 4, and we also had Dr. Nord and Dr. Bonner doing cases. Also, as mentioned, we had Think surgical robot that was busy. We had 58 cases in September, and that's the highest monthly volume we've seen since the launch of the Think robot. Dr. Saw did 46 cases, and that's the highest that this calendar year. Dr. Bonner and Dr. Dearborn also did cases with the Think robot. In terms of other cases, you can see that was unfavorable to the budget by 8. ENT and thoracic were below budget. Also, neurosurgery was below budget by 3 cases. And then lastly, vascular was also under budget by 2 cases for that month. Cath lab for the month of September came on right on budget. Good job budgeting, finance and operations, I have to say, very consistent. Inpatient cases for 102 were very much right on the budget, and then outpatient cases of 80 were favorable to the budget by 1. So very much right on. We did 3 microclip cases for the month of September. You can see the breakdown in terms of our cases. Interventional radiology was very busy for the month. Cardiac was just under budget. Neuro IR was under by 4 cases, and vascular under by 8 cases. So interventional radiology really did many cases that month. Looking at our deliveries for September, we came in again above budget at 133. Above budget by 5.6%. I will note that there were 2 sets of twins for the month, but we just count them each as 1 delivery. So we have more babies, but we had 135.
One mom.
How does the mom count?
We had a discussion with finance about how they count.
I'm just waiting for the quintuplet.
Be here.
So, C-sections were 37.6% of total deliveries, as you can see. So continue to be busy there. Looking at our non-emergency department outpatient visits trend, came in at 9,275. They were favorable to the budget by 11.3%. These were basically driven in 3 areas. We had an increase of about 10% in lab visits, about 16% increase in imaging services, and then outpatient wound also was over 40% in terms of volume increase for outpatient wound care. So it's just driving our those visits. As mentioned, our emergency room was also busy, and overall, the visits came in at 5,381, which was favorable to the budget by 9%, or 445 visits. Also favorable to September of 2024 by 7.9%. So, again, a wide range of visits that we continue to see, and also with trauma at a busy emergency room for the month. Looking at our gross revenue recap for September in terms of broken down by our major groupings, you can see surgical services revenue was favorable to the budget by 8.2%. Again, cases were 65 or 13% favorable to the budget. And trauma revenue brought in $3.6 million and was favorable to the budget by $942,000. Our cath lab revenue was favorable to the budget by 4.6% in terms of the mix of the cases. Room and board, as you can see, was below budget by 5.3%, but trends with the lower patient days, and especially those lower IMC and ICU days. Birthing center, as you can see, was above budget by 15.8% in terms of our 995,000 in terms of that, and a lot of that was driven by our higher C-section rate. ED was above budget by 7.9% and ancillary by 10.9%. So overall, strong gross revenue in terms of overall for the month. Looking at our payer mix, overall, in terms of government payers, we were favorable. We did have less Medi-Cal and more, but slightly more Medicare, but overall was favorable in terms of budget. We saw 3.1 versus 3.9% in terms of HMO. The PPO was stronger in terms of actual versus budget, 20.7% versus 19% overall gross revenue. You can also see self-pay was pretty consistent, and TRICARE was a little bit, was unfavorable to the budget. Looking at our FTEs, productive FTEs for September were favorable to the flex budget by 25.8 to 1.7% at 1,487.2 FTEs. Moving on to non-productive, also favorable to the budget by 31.5 or 15.6%, coming in at 202 FTEs. Then overall, in terms of total FTEs for September, were favorable to the budget by 57.2 or 3.4%, and coming in at 1,689.2. I know Ajay talked a little bit about our total FTEs per adjusted occupied bed. For this month, they came in at 5.96, which was favorable to the budget of 6.14, and as you can recall, in August, it came in at 6.07, I believe is what it came in at. Moving on to our radiation oncology center treatments, I know this is something we've been talking about and looked at. There are many, as you can see, we came in for the month of September at 173 treatments that was unfavorable to the budget by 205. And really looking at this has been multifaceted in terms of the impact. But one of the things we've been seeing and I've been talking about, we've had very low number of new starting patients for treatment over the last couple of months. And so we're seeing a slow ramp up in terms of number of treatments. I did talk to, we were looking at October. October has, the number of treatments per day has increased. Today it's at 17 treatments per day. Next week each day is at 14 treatments per day. So we're starting to see increases in terms of the number of treatments per day. But overall, we're just seeing a longer time period between getting consults and actually starting treatment. And we're seeing that more people are taking longer in terms of getting chemo or surgery and then starting radiation at a longer time. So we are continuing to look at this. It is what others are seeing, and UCSF has been talking to us about what they're seeing too from that side. you look at the next page, you can still see, we're seeing, in September, we received 29 new referrals. We saw 26 new patients in the clinic. And our conversion rate for September so far, was 34%, which was higher than August, in terms of 18%. So we're seeing slowly improvement in terms of it. But it is something we're continuing to watch. We're still seeing a lot more of the IMRT, the more complex treatments being used also for patients. All right, moving on to Washington Health Medical Group. Our clinics were unfavorable to the budget by 1.6%, so just under budget, but favorable to September of 2024 by 8.7%. We did see lower primary care visits, mainly in Nakamura, due to unanticipated time off by one of the providers, but we did see that offset by our specialty care visits that were above budget by 2.3% in GI, women's health, and in plastics. Moving on to our development corporation. Overall, our outpatient visits of 2,477 were favorable to the budget by 119 or 5%. So the broken down, our Washington outpatient rehab visits were favorable to the budget by 11.4%. So they continue to be fully staffed. That is helping them in terms of being able to see more visits than they had budgeted. We are seeing in terms of Washington Outpatient Surgery Center, they were unfavorable to the budget by 7.6%. Some of this was in GI and ENT. We also had planned for increasing the hours in September to accommodate a closure that we were going to do. We need to do an HVAC installation there, but we've had to push that out because it's still going through the process of getting approved. So I think in the budget, we had built in more time for those more visits, treatments and visits for those cases in WAS. PSC was also under budget. We had less pain management cases, but orthopedic cases were below budget by about 12. Dr. Dearborn was at budget, but Dr. Christora was doing more of his cases, I think, over on the hospital side with the robot. Moving on to our key financial statistics in charity care, you can see our days cash on hand did increase 8 days from August, and this was mainly due, we did we talked about having an IGT, intergovernmental transfer. We did receive the funds for some of our supplemental programs, our QUIP and our HQAP, and that was close to $10 million. So that helped in terms of bringing in additional increase in our days cash on hand. As you can see, September charity care for the month came in at about $201,000. We've also, our revenue cycle team has been working hard in terms of our AR days, and we've continued to see those trending down. They were at 54.4, which is the lowest we've seen since April of fiscal year 20. So really been working in terms of those accounts receivable days. And then lastly, just doing for the quarter in terms of July through September, you can see we had total unreimbursed costs for the period of about $1.9 million. We had about 521 patient encounters, representing about 322 unique unhoused patients. Of those unique unhoused patients, we had 86 that had multiple visits to the hospital. And as remember, unreimbursed costs include food, clothing, pharmaceuticals, DME, transportation, housing, additional unavoidable inpatient days too. So that is the report for September. Any questions?
Questions?
All right, the fee section is kind of long up, I guess, for the last 8 months now.
Yeah, so it's a little bit different. This is the pure C-section rate. I know some of the other numbers that we saw take into a subset of that, but yes, And I think we've talked about, some of the work that we are doing in terms of looking at that C-section rate. And I know that Dr. Kupampu is, has been, talking to the physicians about that and looking at, you know, in terms of what we can do in terms of ensuring that we're not doing the elective C-sections. And so that is something that, we can talk more about too. Any other, okay. Let's move on to Employee of the Month for October 2025. It is Van Alvinto. He is the Service Desk Analyst in Information Services. He was very excited, and we were excited to be able to present this Employee of the Month to Van. When it comes to health system roles, a Service Desk Analyst can be overlooked until you need one. As we all know, when it comes to computer questions or issues, Van is accustomed to troubleshooting with somewhat panicked coworkers. He resolves issues with a calm confidence that lets his customers breathe a sigh of relief. When Van began working for Washington Health, he was a contractor working the service desk night shift. Service desk analysts working nights must be able to speak with coworkers on the phone and also be able to go where the issue is. Their skills need to include competence and ability to understand situational priorities. Van's work ethic and skill set led to a full-time role working days. Van contributed to the setup of the cardiac clinic in the Fremont Office Center, and soon he'll be working on the urgent care in the UCSF Washington Cancer Center. His skills will be needed to set up imaging and desktop computers, as well as working with the Epic team to ensure flawless patient care. While most members of the information services team rarely work directly with patients, they know the work they do enables caregivers to provide accurate, timely care to our patients. In this way, everyone in IS provides patient-centered care. Van was raised in the Philippines, where he earned his bachelor's degree in computer engineering. He commutes from Modesto every day to be part of our health system team. His manager, John Bell, says when it comes to supporting the organization, Dan is professional, compassionate, and goes above and beyond what is required. We appreciate his flexibility, including adjusting to schedules when needed to ensure adequate coverage. When not at work, Van can often be found on his mountain bike exploring trails. He also enjoys traveling and is looking forward to a trip to Rome, where he will experience the Holy Door of St. Peter's Basilica as part of the Vatican Jubilee. Congratulations, Van, our October Employee of the Month. We have a great-looking IT team there. All right, moving on to past health promotion and community outreach events. I am just going to highlight some of these. I will say September and October has been very busy, and there's been a lot of community and health promotion events, and really want to thank Kayla and Angus and the trauma team. They have all been out in the community along with many others, staffing a lot of our different events that are happening. As you can see here, we were on September 13th, we did the Walk to End Alzheimer's. On September 17th, Polly's Heart Health Fair in Ruggieri Senior Center at the Union City. Also, we were involved in the New Haven Schools Foundation Mutt Strut on September 20th and the Newark Days Parade also on September 20th. I also do want to do a shout out also on September 20th on the next page, the Special Care Nursery reunion. I think we've heard a lot about in terms of our special care nursery, and that whole team pulled together and did a reunion, and so many of the families were so appreciative of, and the babies and kids, in terms of all that was NECA and her team and the physicians all participated, and just it was a wonderful event for that reunion, and I know we'll be seeing lots of pictures of that too. As you can see too, we were involved in the on September 21st, the Fremont Disability Resource Fair. I do just also want to thank the trauma team again. They were September 23rd, did fall prevention education at Lake Elizabeth. And moving on to the next page, a couple of the others. Dr. Seema Sehgal has been very involved and out in our community, and She also, on September 24th, did a suicide prevention awareness support and hope talk, and it was on Facebook and YouTube, and as you can see, it got over 588 views. Maria Nunes, our nurse practitioner for neurosciences and diabetes, was out on September 25th, did signs and symptoms of stroke at Acacia Creek. Also, again, on September 25th, our trauma team was at Federico's Grill. As you know, we've done a lot of work around choking, first aid, and did more education and celebrated Pico's birthday celebration there, and so that was a great event. Also involved in the HERS walk at Quarry Lake on September 27th. And moving on September 27th, also we had our drive-through flu clinic. So Washington Health Medical Group did that, and we did over 800 flu shots that were administered on that. So you want to go to the next slide? Yeah, thank you. You can also see that a wonderful event on October 4th in terms of so many different departments and groups and organizations participated in the community safety fair. And again, want to thank Kayla and the trauma team, Jen Kubitz, and many others who helped to put all this together, and Angus Cochran. We had over 500 attendees at this community safety fair. It was really a fun event, especially for the kids and all the shaved ice and everything that they got to receive there. Dr. Seema Sehgal, also on October 4th, was the honorary chair of the National Alliance on Mental Health Illness, and that was a walk at the Fremont Central Park. Also that day, we were represented at the Fremont Downtown Dog Days by our WHOOP program team too. So moving on, you can see tonight there is a breast cancer screening impact of 3D mammography that Dr. Upender is doing a talk on Facebook and YouTube. So very busy month, I have to say. Mm-hmm. Yeah, pictures, yes, see all those. These are our upcoming ones starting tomorrow. As you can see, again, have many of our trauma team out in the community doing choking first aid. And also on October 15th, City of Fremont Wellness Expo, we will be hosting a booth there. I do just want to mention October 16th and Think Pink. As you know, that occurs in the tent after our Top Hat, which will be Saturday, and that's the breast cancer awareness event. And really, it's a wonderful event that so many people work to put together. So just want to make sure all of you are aware of that. And then also just we will be on October 25th in Newark Dia de Muertos and be participating in that. And you can see again in November some of the areas that we will be involved in moving forward also in November. So very busy community activities, and then just as we all know, on Saturday is the 39th annual Top Hat Gala. Very excited for the theme of Wicked, and as Dr. Berry talked about, we will also have some of our robots that will be there, just some demonstrations without the patients to show how they, what they can do, and so we're very excited for that. We've also have, on December 11th, I want to say the ribbon cutting for the UCSF Washington Cancer Center, so we're very excited to be doing that too. Those are some of the many events that are happening over the next couple of months. turn it back over to you.
Yes, thank you. Additional action items, or anybody